Hi, I'm Glenette E. Davis, LA's health equity nurse. Welcome to your RX for Life, your prescription for life, where we believe that through having healthy conversation with amazing doers, everyday people will find the tools they need to do more, be more, and achieve more. Today, we are talking to the amazing doer, Tomi. Tomi creates educational content and provides mentorships to public health students. She is a public health mentor, providing undergraduate students with the skills that are needed for them to be efficient healthcare professionals in the workplace. Please don't forget to like, subscribe, and comment. This is your health equity resource. And because success leaves clues, not only clues to business building, but clues to the keys of life, health, and wealth, Tome, I want to say thank you for answering the call. Thank you for saying yes. Thank you for showing up. And thank you for not giving up. I am so here for this. Tommy, will you please talk briefly about what it is you are up to right now?
Well, currently I have three different positions that relate to public health. So first off, I'm actually a federal contractor with the CDC quarantine station, in which we do stuff related to the COVID-19 in terms of screening passengers who are traveling to the United States and they have to land through JFK. Second, I also am a adjunct faculty member at Hunter College's Arbery School of Public Health. So that's where I teach epidemiology courses to undergraduate students. And then lastly, I am actually transitioning into a new role of actually a supervisory role um, with a hospital, New York City Health and Hospitals Corporation. And with that role is also in response to COVID-19. So that's where we're going to do contact tracing with individuals in the community. So there's three different hats in public health. So have to learn how to balance it all and stuff.
Oh, that's wonderful. And that's deep. You are firsthand witnessing a lot of things. Can you please
Yeah.
let our listeners know what it means to be a public health professional and what is epidemiology in layman terms for our listeners to be able to connect with this content today?
Okay, so first off, I'll explain to you what epidemiology is. So epidemiology is the scientific discipline behind public health in terms of trying to understand why diseases spread. In addition, epidemiologists are able to understand the efficacy of a vaccine, and then also trying to understand, the burden of disease in either a country or state or city, or even new cases that emerges. Then to your second question about being a public health professional, being a public health professional takes actually, one is a lot of work. Two, you have to be really interested in understanding a nation's health or even a population's health. Have to be an effective communicator, both orally and also in writing. And then lastly, it takes a lot of like dedication and um, be able to wear many hats and be able to follow trends. So like, for example, with the COVID-19 pandemic, you see how it happens globally, but it's best to know what's happening in your own country and then also see how things are changing over time. And also be able to think very critically and be able to problem solve and also be able to work in a team setting as well.
Wow, that is a lot. So when you talk about the efficacy of like vaccines, just how well something like that works in certain populations, who may respond better to maybe that version of it, or would they create more to kind of help out populations that a certain medicine is probably not working for? Is that something that
Well, well,
efficacy
it
looks
really
at?
depends. It really depends. So if we're talking about populations, you could break it down into a lot of categories. That could either be age groups, that could be gender. Um, Also, I don't really know when it comes to terms with racial groups, but specifically
Mhm.
how I've been taught and my experience is also just specifically related just to age groups and gender
Mhm.
groups. So for example, like with this COVID-19 pandemic, yes, they're trying to figure out, vaccinations, but
Mhm.
we don't know how is that going to affect different populations group,
Right.
especially when it comes to socioeconomic status as well, who has access to it. Also, they do have to, see how well it works not only on animals, but then how's that's going to translate it to the vaccine being into humans. So how it's
Correct.
actually going to react to them in terms of like the immune system, etc.
Okay. Okay. So when they do the groupings of which population it may affect, race is really not a factor in this then because it's by age
Well,
and
well, if you want to put race into it, I would only talk about in terms of who has access to it. So you could
hmm
put that as a racial factor in that
okay.
sense.
Okay. So tell me, as a public health mentor, in your opinion, what public health training is missing from organizations who hire to serve communities of color?
I would say people who do not have a good grasp on understanding the U.S. health system in terms of who has access to certain services, even the ability to obtain health insurance. And then three, trying to understand how different racial groups are being affected in terms of their treatment of either public health or healthcare services. And then another thing will be trying to be much more knowledgeable in terms of the importance of cultural competency and health
Mm.
literacy. So,
Health literacy and cultural competencies are very big issues. And I believe that like diversity and inclusiveness probably should be rewritten to get the people's story instead of it being some study that someone has done on people, but to really have that conversation to find out what it is that we as Black women, we as Latino men, or whatever we may be in America need
mhm.
from the healthcare system.
Yes, that's why they're having this emergence of qualitative research. So there's one thing to have quantitative in terms of numbers, this is what's
Mhm,
going on, but
mhm.
qualitative in terms of how are people feeling, how are people thoughts towards X, Y, and Z in terms of receiving either public health programs or healthcare services through
I
different
love
types
it.
of healthcare facilities. So
So
I
there's
remember
been a shift. Yeah. So it's
yeah,
great.
so I remember, and yes, I remember when I was a public health student in graduate school, I took a course on qualitative methods. So I saw the importance of, having focus groups and then how that focus groups with the different statements translate to the quantitative numbers that I got from like surveys. So then there's also something called mixed methods in terms of
Mhm.
it's a combination of both quantitative and qualitative. So there's an emergence of that, especially when it comes to vulnerable populations. So people, for example, the Black community or LGBTQ, et cetera. So
Mhm. So public health is really putting an initiative out to get the people's perspective and to put it into numbers for everyone to
yeah,
not just understand it statistically, but to understand it from a humanistic point of view.
yes,
Okay,
that is correct. Yes.
that's great. So how did your passion and how did you get this passion in public
Oh.
health?
Well, it started when I was a junior in college. So I was actually a biology and health science major, and I saw that biology is nice. You work in a lab, but it's for me it's easier to talk to people and trying to understand the health aspects of it. So my actually interest in public health sparked when I actually studied abroad in Argentina. So that's where I learned about the Argentinian healthcare system from the city point of view, and then I spent 4 weeks in the township. So I was able to see the disparities for people who live in a township, and then we even went to the low income areas where the indigenous people were, and we saw that how they didn't have any access to water. And it's interesting how something called Iguazu, that's the waterfall. So they just live really nearby and they wouldn't have access to it, but Iguazu is a resort too. So it's pretty interesting. And then from there, that's where I learned about, rabies. I learned about like maternal health, domestic violence, and how that relates to public health. And then after that, I actually had a mentor there. And during the time, I was actually writing a proposal to create like a children's book related to dental care. That's when I was interested in dentistry and public health. So with that said, after I graduated, I went to South Africa to implement a children's oral hygiene book in which the characters that had South African names. We actually went to the townships in Cape Town to teach the children about oral hygiene and best practices. And even if the families cannot afford toothpaste, we told them alternatives like baking soda, etc.
Mhm,
And then
mhm,
from there, that so from that experience, it solidified, my interest in public health more, and that's when I went to graduate school. So during that time, prior to going to graduate school, there's this program in which students in undergrad or even their first year um, in a master's program, they could apply to a program called Healthcare Connections. It's actually
Mhm.
based in California. So with that program, you just have to apply, personal statement, and then there's 3 rounds of interviews. So that's when people are in that program, they do an internship in either at a foundation or a hospital setting, and then once they finish, they have to give presentations to their
Mhm.
preceptor and the people in the program, and then they receive jobs after that. If they do
Okay.
really well in the internships, and then they also receive a job list too as well. So I'm always receiving, job lists like there's public health jobs in California, in Boston, New York City, etc.
Mhm.
And they even
Okay.
pay them 4,000, so it's pretty good.
Oh, great. So the opportunities are pretty plentiful for someone who's wanting to be interested in public health.
Yes.
Okay, so what has been your greatest challenge to date, either as a grad student or as a mentor or as just a public health professional, noticing great health disparities in our nation here that may be synonymous to someone in a third world country that you have had the pleasure of working with?
The greatest challenge would be being able to explain to people the importance of public health who work in a different sector. So, say for example, if I was talking to someone who's in the
Hmm.
business world, I have to explain to them, with dollars, why do I want a certain program to be funded, and for a specific population group or even a specific area. That's one aspect of it. Two, I would say the education. So, like with this whole pandemic, right? I actually teach the U.S. healthcare system at a different school. So I saw that, with these undergraduate students, it'll be kind of interesting to explain to them, okay, this is what's happening now. So how can I create case studies in terms of how people with a certain health insurance status are able to have access, navigating as a patient in the
Hmm.
U.S. healthcare system with this pandemic. And then also we're
Hmm.
talking about culture competency, and then also
Hmm.
talking about, with public health, the country actually funds it 3 to 5%. So
Okay.
now with this, they had to actually pull out a lot of people, deploy them into different areas to work on different areas related to public health now. So that's one
Okay.
big challenge. And then the other one is be able to articulate clearly to my students in terms of I'm giving you this didactic knowledge in terms of the US healthcare system, epidemiology, but I want it to be more hands-on. So what I've
Right.
done so far is like, yes, we have worksheets, videos, but I went to go speak to someone who creates materials in terms of trying to understand more of like what a communicable disease is, just bringing more
Right.
outside resources for them to understand fully um, that this material is important. And then also too, for more of hands-on experience, I teach them how to, calculate some stuff using Microsoft Excel, which
Hmm.
is pretty it's to know Microsoft Excel is good before you jump into other statistical software packages such as SPSS, Data, or
Right.
SAS. So,
Okay. Okay. So I have a question about your didactics and the training. Say you want to distribute your information. Do you give products back to your students to maybe take back to their place of employment? So how does this information get to people who may have less access to the healthcare system? How would you, what would be your recommendations to educate someone who may not be able to go to college or is not in the boardrooms or not listening to you spin healthcare into numbers in a different language for them? How do we get this to people who are at higher risk of health disparities?
well, there's a lot of like YouTube channels. So, like for
Hmm.
example, I actually go into like Harvard School of Public Health and they actually
Hmm.
teach courses on epidemiology for free.
Hmm.
I actually
Hmm.
just finished another course for John Hopkins in terms of contact tracing.
Hmm.
Another way is that there's also Khan Academy,
Hmm.
in which they explain some more didactic materials. There's also Boston University. They have like this free module in terms of they teach epidemiology too as well. In terms of other things, um, hmm, I know one of my colleagues sent me a site for high school students
Mhm.
to learn about epidemiology, and then there's also the CDC as well. So with the
Okay.
CDC, they have like different quizzes in which covers different topics, especially related to epi. So
Yeah,
it's
so
a lot of
I think
materials out
focusing
there.
on children would be a great idea because,
Yeah. So yeah.
you get them young and take it with
Yes.
them.
Yes.
Yeah.
So yes, there's like another material I found out too. It was through like it's a program similar to something called College Now. So College Now, it pipes through high school students,
Mhm.
but there's actually like this PDF in which they give them information in terms of like, this is an outbreak, this is a type of case study, what would you do, X,
Mm.
Y, and Z. So there's out there, but it takes a lot of like research and digging. So there's a lot of free
Okay.
materials, but
Great,
it'll be
great.
interesting to teach this stuff to middle school and also elementary students.
Right, right. Important words, especially right now in this
Yes.
post in this COVID season that we're in and post COVID, because we really don't know what the long term effects are going to be, whether or not it's going to be a seasonal reoccurrence or if it's just going to mutate and people are going to
Mhm.
have it as a common cold. We don't know. So for
Yeah.
them to know how to map these things out and what the effects are for themselves and how to protect themselves would be a great educational tool to take with them into their adulthood. So, how do you
Yes.
balance it all, Tommy? How do you balance the three hats
Ooh.
that you wear and then the stuff you do on YouTube? And just, you have great
Uh,
intention behind it all too. So I know that's the passion part, but how do you balance it all?
be honest with you, I don't balance it really well. um, like I really
Balance,
don't.
what's
But
that? I fall all the time.
I really don't, because usually I'm like in high stress. So what
Uh-huh.
I've done now is that my stress actually has reduced a little bit because
Uh-huh.
it's online teaching. So what helped me is that I had recorded videos already, so just posted there and just hold online office hours. And then to reduce my stress, I went actually part time at the CDC on Saturdays. So I just finished working yesterday. So it's
Wow.
interesting. Yeah, just because
That,
it's an opportunity of a lifetime. So I go there on Saturdays, pick up shifts whenever, just to learn more about like contact tracing when it comes to like the airplanes, etc. And then Monday through Friday, I'm in training now with my job. So like now I have to there's like some books in terms of how to like manage people, and then
mm-hmm,
also it'll be interesting to actually manage a team remotely. So I've
mm-hmm,
never done that, but whatever I learned from teaching, I'm able to translate that in terms of like, okay, I could teach online, so I probably know how to manage a team online. I just have to
mm-hmm,
make sure that we do our nice introductions, make
mm-hmm.
sure I'm very organized, have
Right,
schedules, and try to,
right.
um, be more available, because now for our jobs we have cell phones. So if they text me, I have to make sure it's short, quick to the point, and also tell them when I'm taking my lunch break too, so they
Mm-hmm.
know like when I'm available or not. But
Right.
in terms of balancing, I do make time to exercise. That's really important. Then I also had to switch my diet up too. So like now it's a new month of June, so now I told myself I'm just eating vegetables, fruits, drink water. If I want fast food, that's once a week. And then for the sleeping, I've been catching up on more sleep. I even had to reduce my social media usage, because I mean, there's a lot going on, and then two, I realized, too much social media, it's not good for one's
Mm-hmm.
mental health.
Right.
So
So I hear
yeah,
you. I hear that you have said in order to reduce the stress and to survive all of this
yeah,
changes that you have reduced hours at your
yes,
job and you went part-time at the CDC. Even though it
yes,
was an opportunity of a lifetime for you,
yes,
you had to figure out where to make some cuts at, because the truth
yes.
is that we can't make time. We have 24 hours in a day, and we have
Mm-hmm.
to be able to allocate some us time so that we are not tipped over and out the game. I hear
Yeah,
that you have decided to eat live foods, eat some root foods and drink some
yeah,
water, which is life. And that is amazing for you to even take that step. And then cardio. To
Yes.
exercise and sunlight so that you're, doing the things that you need to do to make sure that you are staying healthy, and you're working and you're teaching. So you're serving, you learn and you serve. So all of these things are great for balance, and all of it is great for advancing in life. So I applaud that, a public health professional putting her health first, which is great.
Thank you.
Which is great. So tell me, what is one word of advice you would give to your younger version of yourself?
Oh, one advice is us just to continue to mind my business. That's the best thing.
You
Yeah,
know, you
peace
can't
of
say no healthier than minding your business.
yeah, you get peace of mind. Trust me, peace of mind.
And like, I'm
Just
minding my business. That's
yeah,
it. So I have
yeah,
a
peace of
question for
mind.
you. One more
Yes.
question. What's one question you wish people would ask you more often?
Oh, how am I doing? Yeah, how am
Yeah.
I doing? Instead of like what can you do for me? So more
Mhm.
like how am I doing in terms of like, okay, I'm in like these high stress jobs.
Mhm.
So it's like it'll be great to someone to ask me, how you're doing mentally, physically, spiritually.
Mhm.
So that's really important because yes, people they can be doing amazing things with their career, but they may not be there mentally all the time or like
Right.
physically, etc.
Right.
So
Because we can get into a tunnel vision, and like
yeah,
we're just doing and doing and doing, and we're not really enjoying anything. And it's just become so taxing and overwhelming. And before we know it, we're so far off of our path and so
yes,
far removed from who we are, and hadn't even put ourselves in the best position to flourish and grow. It's just like I'm just out of place. I don't even know where I am.
yeah.
So yeah, that's great. That's great. So is there anything else that you would like to share or offer? Any last words of advice for our viewers?
I would say for people to take care of themselves both physically and mentally,
Mm-hmm.
and then also make time for yourself, even if it's like 1 hour, just to
Mm-hmm.
reflect on the current day and what you can change for tomorrow,
Mm-hmm.
just day by day, and also find different ways, to cut back on things in which you think are taking up too much of your time, in which you can actually
Right.
allocate it to something where you better for you and
Right.
also to make an impact on other people. It could be the small or large. So, and don't compare yourself in terms of like how other people are doing, because you are you for a reason. So,
I
yeah.
think comparison is self-sabotage magnified times 100,
Yes.
because I can never be who someone else is. But you can step into your own light and be your glory and attract your own people and be your own self and be okay too.
Yes, I recently read a quote by Bill Gates. It stated, I'll paraphrase. It stated that if you compare yourself to someone else, you're basically insulting your own self. So when I
Wow.
read that, I said, okay, it's
Wow.
Bill Gates for a reason.
Wow.
So
Exactly.
yeah,
Exactly. Do you do a lot of work with Bill Gates in his initiatives?
no, I just read about it,
Yeah.
but
Yeah.
we'll
And
see.
he's
Maybe in the near future.
he maybe in the near future. Yeah, he is definitely a wealth of information. He has so much wisdom and intelligence, that is strange sometimes. So
Yeah,
it's okay to be strange, because strange people do amazingly strange things which benefit so many people worldwide.
yeah.
Yeah. So follow your RX for Life for more live interviews with amazing doers. Get group trainings, health equity plans, and workplace healthcare education here. We are here, so let's heal our broken places. I hope that you decide today to do more, to be more, and achieve more. Don't forget to subscribe to Your RX for Life to be notified for upcoming lives. Some live attendees will receive free stuff. Until next time,
Thanks
be
for having
well.
me.